Hello everyone, welcome to Worsten's Clinic. My name is Dr. Alberto, and today we're going to talk about gastrointestinal health, its correlation with autism, and the application of ancillary therapies, the common ones, as well as the stem cells. Now, as a disclaimer, I want to mention that the nature of this presentation is to highlight, to make awareness, and make as clear as possible, yet simple, the importance of the gastrointestinal health. What I mean is that it's, I'm very well aware that most of the families know about the importance of gut, but there is a huge amount of families that it's not sufficient enough. It's too much information, it's overwhelming. Maybe they are overlooking the situation. So I want to convey, if there is no gut health, there is not going to be improvements. Once again, just emphasizing, this is informative. The nature or the purpose of this webinar is to be for educational purposes only, and it should not be taken as a diagnostic. It should not be taken as the ultimate prescription. Remember, nothing is settled in stone. So the idea is to identify individual needs of a patient. Remember, there is no kid, there is no patient that is exactly the same as another one. Therefore, the approaches, the therapeutics, the prescriptions should be individualized. Once again, this is only for educational purposes only. Can we help you? We can help you as much as we can. But once again, we have to figure out where we are positioned with your kid. Now, when we talk about objectives of today's presentation, I want to talk about gut abnormalities, the 3 common situations that everybody can identify at home, notice, and how to pinpoint symptoms. I also want to describe the 4 most common things that can be ruled out for free, very simple, or for free-ish at home without anything in particular. I want to explain and to share with you some basic pearls or fun facts about different approaches or suggestions that can be done to help our patients, as well as how ancillary therapeutics, as well as stem cells, is going to work in a positive way, impact in a positive way in the gastrointestinal health of kids within the spectrum. In order to do so, we have to remember what is autism. Let's just remember from the previous webinar in which we discussed it. Keep in mind that we are talking about an array, a group of symptoms, a syndrome that usually affects behavior. Yes, it affects communication, social skills, motor skills, and whatnot, depending where the voice or the girl is positioned within the spectrum. We are going to focus today in behavior. Why behavior? If behavior is not addressed, it's going to be very complicated to move forward in any other improvement. General interest in a kid within the spectrum is going to be affected, and the symptoms are going to be, the symptoms expressed are going to be present in a kid, and it's going to be exacerbated if there are gut issues. So, having said that, let's start with gut abnormalities and the correlation with autism. Now, common symptoms. I like to separate here what you can see as tutors, mom, dad, as therapists, as people in charge of a school, as well as doctors, physicians, biomedical doctors, etc., etc. So what you are going to see, or what you're going to identify that is not a common or a normal action, rumination, the fact that the child is actually like regurgitating or like about to throw up some of the food that they are supposed to be digesting. Abnormal stools, I'm not talking about diarrhea and or constipation alone. I'm talking about undigested food. I'm talking about mucus. I'm talking about color. I'm talking about smells. What you can actually notice is a reflux, which is one of the causes of throwing up. Food refusal, very, very common. This is every single time that families say, hey, my kid is very picky eater. My kid only eats raw carrot and they don't eat cooked carrot. My kid only eats crunchy stuff. My kid only eats soft or mushy stuff. My kid only eat in the shape of a pancake. However, they do not eat the rest or in different textures. And the one that is extremely important, growth retardation. We're going to talk about that in particular as well. On the other hand, we have to put ourselves in the shoes of the kids and understand what they are feeling, and that is the nature of why the behavior is being impacted or changing. They are going to be struggling with abdominal pain. They are going to be struggling with distension, with gas, bloating. They're going to be struggling with a lethargic response. So if you are calling them by their name, if you are looking for some sort of answer and they are not responding, there is a high possibility for them to be struggling with gastrointestinal problems. And cramps. Cramps is very, very common, not only because of the presence of gas, but just because the motility of the gastrointestinal tract, it's abnormal. So if there is no regulation, there is going to be discomfort. That's for sure. That is pretty much a rule of thumb. And this is not only strictly speaking for patients with autism. This applies pretty much for everyone. So keep in mind this, because in some cases it happens. My kid has reflux and the doctor is going to prescribe some anti-acid. That's not the best approach. That's just a patch, okay? Let's fix the situations from the core, from the root. Talking about stool changes or stool abnormalities, common ones, diarrhea and constipation, or in some cases, patients that are back and forth between one another. Per definition, diarrhea is the presence of stools of up to 3, in some cases up to 5 presentations per day. Again, per definition, the stool should be soft to loose or in some cases liquid. Traditionally, they can be smelly. It's not a rule, however, they can be smelly. And they should not be mucoid. There should not be mucus, there should not be phlegm presentation, there should not be blood. So if you see any of those 3, we have a bigger problem, right? So it's always needed to identify if the kid with autism has diarrhea, let's rule out the first part. No mucus present, no blood, all right? What is going to transpire with the kids? Irritability, tantrums. You can actually notice undigested food. Why is this? No, there is no absorption. There should be liquid, there should be nutrients, there should be food every time we eat and the digestion takes place. If there is inflammation, if the gastrointestinal tract is not absorbing, everything is just going to pass through. Constipation. Constipation, there is a tiny myth in here that everybody believes that constipation is related to how hard the stools are, and this is not the case. Constipation is always related to the frequency of going to the bathroom. There are some cases in which, per definition, constipation means that going to the bathroom once every 10, maybe 12 days. Yes, that's a lot. So being constipated means that the stools can be bulky, can be large, can be in the shape of ribbons or snake shape. They can be thick and large as well as thick in diameter. This is not exactly that much important. As well as what I said a few moments ago, constipation is not related as a stool being very hard. It's not like the kids are pooping rocks. It's the time. However, from the medical standpoint, medical perspective, there's always needed to consider dehydration. They need to consider colon motility or colitis or irritable bowel syndrome, anything that is actually diminishing the motion of the gastrointestinal tract. And it's always, always, always going to transpire in pain. Pain, it's a symptom. We mentioned it in the previous slide. It's going to affect behavior. Earlier, at the beginning of the presentation, I mentioned this is something that you can identify at home just by mere and pure observation. Right here, you can see that there is a Bristol stool chart. You can identify what's wrong, what's okay. Traditionally, the normal stool should be like type number 4, the number 4. So should be smooth, yes, traditionally that's the utopical part, but it's also depending on the diet, and it's also going to depend on absorption. Now, let's move to the next symptom or gastrointestinal abnormality, abdominal pain. Abdominal pain is related to behavioral changes. That's a fact. According to the American Academy of Pediatrics, behavioral problems are manifestations of pain, discomfort, gastrointestinal difficulties in every single patient within the spectrum. How is this going to transpire in kids? As an adult, you can have pain and you can take a pill, you can sit down, you can rest, and you can try to deal with it or to cope with it in the meantime the pain sensation goes away. That is because you know how to express it, you know how to understand it, you know what to do, maybe you know how to call for attention or for help. In kids within the spectrum, none of those takes place. So what are the symptoms or what are the situations that you're actually going to see if there is a gastrointestinal issue such as abdominal pain? Self-inflicted injuries. This is the worst. In my opinion, this is something that should not even exist. However, it's an instinct. It's an instinct in some kids. It's a way to relieve pain by causing more pain in a different area. It's like distracting the pain, as ridiculous as it may sound. Aggression, again, it's an instinct. Everybody has had a bad day and everybody wants to play a joke on you on that terrible, nasty day. And it's not going to be a happy moment for either one of you. Kind of the same thing. You are trying to, I don't know, play with your kid. You are trying to take him to therapy. You are trying to, I don't know, use a cell phone, iPad, whatever. And the only response that you're going to get as a result is going to be an aggressive response. We need to rule out gastrointestinal problems. Lack of attention, lack of concentration. This is very, very important. Always consider, I want my kid or my child to speak. I want my kid to be more social. I want my kid to be able to blow me a kiss. I want my kid to be able to I don't know, to go outside to a restroom with me. I am very sorry if gastrointestinal issues are not addressed as much as possible or being treated. There is no attention, there is no concentration. That means that everything is going to be hyper-stimulating and the behavior is not going to be what you're looking for. If there is no attention, if there is no concentration, speech therapy is not going to work. Social skills are not going to develop or are going to develop poorly, and social therapy is not going to work. Why? Again, awareness, concentration, attention is going to be all over the place. Cravings. Cravings is something that kids actually look for when they are having abdominal problems, not only pain, but it's a natural response also known as pica. And on the other hand, it's when the kids are looking for everything that is related to simple or refined carbohydrates. They pretty much, sorry, please don't get me wrong, but they pretty much get crazy if they know that there is a slice of bread at home, chocolate, or regular candy. And the worst, or in my opinion, the third actually, worst case or the symptom is sleeping problems. Yes, kids are still going to sleep 7 to 8 hours a day, but 8 hours of sleeping throughout 24 hours a day. That means that they can sleep 30 minutes, wake up, become an actual tantrum or an actual problem for 2 hours. When they get tired, they're going to sleep for another 30, 40 minutes, and so on. And this is, again, abdominal discomfort, abdominal pain, gastrointestinal issues. Sorry for this so emphatic, sorry to mention it so much, but this is true. It's one of the things that has to be looked at. Why is this? Remember that I was saying something that you can observe and identify? Here we have it. As you can see on the top half, is the common or the usual positions in which that are naturally or followed by instinct, the positions that kids adopt to try to ease pain, to try to ease the discomfort, and this is by creating pressure. So they adopt like the fetal position, they create some pressure against the desk or the couch, they are falling down with, on top of their tummy. So, and this is just a matter to try to ease the discomfort. Ease, not to fix, right? However, this is not normal. This is something that should not be happening. On the lower side of the picture, we are going to see the results of abdominal problems. On the left side, we have this kid that has self-inflicted injuries, when the kids hit themselves so much, when they bite their hands, when they injure themselves. I personally, it breaks me in half. It should not happen. This is something that there is a lot of things that you can do to try to avoid this, especially if we're talking about a pediatric kid, a pediatric patient. It's a lot easier to control situations as in early stages than controlling the situations when the patient is 16 or 17 years old. And the last picture, aggression. Picture is related to a 6 or 7-year-old kid. That much strength they have, that big the situation can become. So if there is something that can be done, let's do it. Next tip, or next gastrointestinal dysfunction, growth delay. Let's identify growth delay as an association to malnutrition, not because you are not feeding your kids. It's associated because there is no absorption. Doesn't matter, maybe your kid is eating a huge portion, but the portion is going through without being absorbed. No absorption means no nutrients absorbed, means no growth. Now, per definition, growth delay is the position of the kids under the common percentile, usually on the percentile, on the lowest percentile, between, by the time that the presentation of the initial symptoms, usually 2 to 3 years of age, and its growth delay, it's only related by weight and age. It's not affecting, or it should not affect, height. Okay, it's mostly weight related to age. Growth delay, once again, it's associated with periods of regression. Very common scenario. I have done X, Y, Z protocol. I have done stem cells. I have done A, B, or C. I go to ABA therapy and a bunch of different therapies. I go to my MAPS software. I notice good improvements, but somehow I regress. Well, not I, my child regresses. Fact, gastrointestinal tract. There is something that is causing more inflammation that it's actually shadowing what you're actually achieving. It's always associated with behavior, especially if we are talking in a very young patient, 3 to 4 years of age. On the other hand, we have the other side of the card, wasting syndrome. Wasting syndrome is also associated with malabsorption, but in this case, we're talking about a little bit older kids, maybe 6 to 10 to 12 years of age, in which the malnutrition is expressed by unwanted weight loss. We are talking about losing muscle. We are not talking about body fat. We are talking about actually losing muscle. Once again, it's not associated with height. It's associated with the growth of the patients. This is, again, this is something that should not happen. We are looking forward to identify, to help you identify, and to help your kids. This is, in my opinion, it's something that a kid should not go through. Now, those three are the common situations related. Maybe I'm escaping abdominal distension, but I like to mention it as part of abdominal pain because it's still associated with gas, pain, and discomfort. So those are the 3, maybe 4 symptoms that everybody can actually identify very easy, even if you're not going to the doctor, right? If you identify those, let's visit a doctor, because there are very basic things that can bring you very good improvements with very few changes. Now, at the beginning, I was mentioning about pearls or facts. Also, at the beginning, I was mentioning the disclaimer, no gut, no improvements. Why is this? The actual correlation between the gastrointestinal tract and symptoms of autism, it's pretty much proven. And I came up with this image in order to try to express it in very simple terms. According to the Journal of Clinical Immunology, as well as the Journal of Pediatric Gastroenterology and Nutrition, there is a huge amount of evidence that in kids expressing progressive autism, we mentioned it 2 slides ago, every kid who is regressing, is not that the kid is losing what they have achieved, is that the inflammation, the problem is bigger than the improvement, okay? There is mucosal immunopathology. In other words, there is inflammation, there is no absorption. No nutrients means poor cellular performance. Now, from a immunological perspective, this means that interleukin number 10, or IL-10 that we have in here, it's reduced. Interleukin number 10 is a marker, is a cytokine associated with anti-inflammation. So the less amount of IL-10, the more inflammation is going to be present. And finally, the 2 points that I have in here, it's something that most of you have heard at least once. More inflammation or abnormal mucosal immunopathology transpires to intestinal permeability. This is going to transpire or to translate into leaky gut and a leaky blood-brain barrier. So what is the nature of this picture? It's a vicious circle. We have a bad gastrointestinal function that transpires to a toxic or a negative metabolism or a useless metabolism. Useless metabolism transpires into inflammation, and more inflammation means exacerbating the autistic symptoms. In my opinion, what we have observed in our patients, most of therapists, families, don't get me wrong, but parents usually like to do their research online and they start doing stuff. That's phenomenal because there is not a better parent than the one that is already informed. However, in our opinion, the number one mistake is that everybody is trying to fix or to treat this vicious circle right here. In our opinion, the vicious circle should be treated or should be initially treated right here. Why? If you treat it in this, at the beginning of the circle, you have 2, maybe 3 different areas to work, from dietary changes, from supplementation, from GIS protocols, parasite protocols, and therefore you can complement it with different neurological therapies. If you treat or if you try to break the circle here only, usually what is going to happen is that you are going to focus on what you want as a parent or what you want as a therapist or what you want as a psychologist or whomever is in charge of your boy at school. The situation has to be addressed or start to be worked out here. This is our opinion. Why is this? It's a lot easier working from the root than just trying to patch or to fix the symptoms. And if you try to do that, maybe you can achieve something, but it's going to be a never-ending story. Sorry to say that, but it's true. Another correlation between gastrointestinal problem and autism, I just mentioned it a few moments ago. Very famous leaky gut. Once again, sorry to mention it so many times. Behavior problems in kids within the spectrum is an indication of gastrointestinal problems. And once again, the studies indicate that symptoms can be caused or exacerbated by gastrointestinal problems. We have it in here in this tiny diagram. Very famous leaky gut, which, by the way, thanks to our researcher, she was teaching me last Wednesday that leaky gut has been acknowledged as an actual diagnosis since 2013. So right here, we have leaky gut progression. Let's make it easy. We have way too much inflammation. It causes the separation or the distension of the mucosa. The mucosa is not able to absorb. That means that if your boy is, or if your kid is prescribed with medication, supplements, it's not going to be absorbed. Therefore, it's going to be useless. Your kid can eat a lot and it's not going to be absorbed, so it's going to be useless. It can be very toxic because there is no metabolism, there is no separation, there is no absorption, there is no immunological activation or immunological action. Therefore, it's going to transpire into food intolerances. This is something that most of the families have a tiny misconception when everybody say, my boy or my girl is allergic to egg. My boy or my girl is allergic to this or that. I believe you. They may be allergic to 1, 2, or 3 ingredients. What we don't believe, or I still don't believe 100%, is when they show me a chart showing me that the boy or the girl is allergic to 75 things. That's not natural. It's not, to be honest, it's not like the girl or the boy is actually allergic. It's intolerant or sensible. And this is the problem because there is no absorption, therefore there is no way to break it down. And the macromolecules are going through, causing more inflammation. So more inflammation, regardless of the type of food or ingredient that they are consuming, is going to cause immunological problems, meaning that a bunch of pro-inflammatory markers are going to arise. And eventually, in the long term, this can, it's not a must, but this can transpire into some immunity problems such as PANDAS and PDD-NOS. Okay? Oh, one more thing. Behavioral problems associated with gastrointestinal issues are commonly anxiety, sensorial stuff, or sensorial issues like sounds and touch and smell, and perhaps is associated with at least half of the cases of OCD behaviors. Now, once again, I was mentioning earlier at the beginning of the presentation that there are things that you can easily do and identify at home, divided in what you can actually see as well as you can physically identify on your kid. What you see: bloating, gassy, burpy, constipation or diarrhea, the stool changes, wasting, losing weight, failure to thrive. Sorry for the typo right there. Failure to thrive. Once again, I do ABC therapy, I did ABC treatment, I did ABC protocol. My kid was thriving and then regressed. Gastrointestinal problem. There is something that it's temporarily addressed, and when that time frame is over, the problem comes back and the improvements fade. The improvements are not going to be lost, but the problems are this big. However, the improvements are this big, but the problem is this big. So let's always keep that in consideration. What you can see, remember, posture pain, when the child is positioning themselves into fetal position or making some pressure towards the abdomen. Behavioral changes, this is the common ones that you can actually notice. My kid becomes aggressive, my kid becomes lethargic, my kid starts to dig into the kitchen looking for candy. I don't know how, but my kid is actually able to know where I hide my chocolates. That happens. I put the bread on top on the top shelf of the kitchen, and I don't know how my kid is able to reach it. It happens. Physical cues. Once again, abnormal stools, not talking about constipation or diarrhea, but smell, color, and undigested food. Distended abdomen looks like usually kids are somehow somewhat slim, and you can see how distended or bloated they may are. That also translates into cramps and obviously pain. And insatiable appetite. Insatiable appetite, that means that they eat like crazy, mostly because they are craving. Okay? So this is something that you don't need a doctor to pay attention to. This is fairly easy to identify. And this is what takes me to the following thing. 4 things that you can identify and start working out at home without any particular prescription. If you notice acne, spots, rashes, white lines or spots in the nails, canker sores, perhaps it's an indication that your kid needs zinc, okay? If you notice muscle twitches or tics, if you notice that the boy is craving for salty stuff, if you notice that your kid is having sensorial issues or that it's constipated, perhaps it's an indication that, that your kid needs magnesium. Top tip, don't use multivitamins. Multivitamin may have 4, 5, 10, 12 different supplements. Which one do you know is working? If you use a multivitamin, perhaps you're just paying for quite an expensive urine, because there are some cases in which 95% of whatever is in the multivitamin is not going to be used and is going through the urine or the stools. Aside of being expensive, you do not know which one is working, and you do not know the dosage that your boy is receiving or your girl is receiving. So It's always recommended to administer magnesium and zinc in an individual presentation. What may be the dosage? I'm sorry, don't get me wrong, but we do not know. Dosage has to go according to weight, dosage has to go according to the needs, and it has to be identified if it's needed. Can you try it? Yes, right? But it's just important not to go overdosing or to go to a higher dosage that it's needed in patients. Again, it's a supplement, it's not a substitute, okay? Now, these are the first two. Which ones are the other two and very common ones? Let's rule out parasites and yeast. How can you identify? Physically, or the physical cues, anal itching. This is a little bit, in some cases, funny because you're going to notice that your body is constantly scratching, or that your kid is, while sitting down, they may be doing a motion like this, or they may be dragging themselves on the carpet or in the couch in order to get some friction with the diaper or with the clothes or with the fabric of the rug. Picking, licking, biting and grinding. It's the most common symptom. Are the most common symptoms associated with parasites. Grinding the teeth is very common. It's highly commonly associated with parasites. If you identify parasites, there are at least 2 to 3 different protocols that consist on taking anti-parasitic medication. How do you know if there are parasites? You have identified some of this, and you may consider, you have the suspicion that your kid has parasites. Stool sample test, easy as that. There are some pages that you can request an actual test online, and they can tell you you have to visit this place, print this document in order for you to be able to the sample to be received, and you can have the test, and that's it. And you're actually skipping, sorry, disclaimer again, educational purposes. You are actually skipping with this, you're actually skipping an actual medical consultation. Is it the best thing to do? No, it's not, but you're starting from a point. That way, in the meantime, you're already collecting information, that way you can share it with your doctor. Yeast. Yeast is commonly associated with rashes, with inflamed cheeks. They look very rubberized. In some cases, yeast facilitates the presence of ringworms, discolored nails, hair issues. You're going to notice, like if they have dandruff, they have the presence of rash behind the ear when there is a presence of yeast. And also yeast causes behavioral changes, making them feel lethargic, like very slow responsive. This can affect social skills. It's not a rule that if you address yeast, social skills going to improve directly. Not exactly, but it can affect social response because the lethargic response, the neurological response is going to be lethargic. How to identify if there is actual yeast? Same thing, just like parasites, stool sample test, okay? Those are the 4 things that you can actually easily identify at home, and you can start doing something even prior to having an actual medical consultation. Once again, I'm not saying that you have to skip the medical consultation, right? It's just guidance. Now, talking about ancillary therapeutics or treatments, protocols, etc., as well as stem cells. I don't like to dig in 100% completely on how stem cells work, because that's something that we discussed in the past. However, it's important for you to have in mind, once again, sorry for being repetitive, no gut, no improvements, okay? Let's remember the triad of autism: central nervous system hypoperfusion or lack of oxygen, gastrointestinal issues, which is the thing that we're discussing today, and chronic inflammation, which is hand by hand. They are boyfriend and girlfriend if you want to, gastrointestinal problems and chronic inflammation. Which are the potential causes or the most common causes of this triad? Genetics, immunological insults, environmental insults, and autoimmunity. I agree. If you notice, I have highlighted immunological insults and environmental, because those are the variables that you can do something about for free, let's say, or initially. I agree there is not too much to do when it comes to genetics other than actually trying to treat the symptoms. Same thing with autoimmunity, but you can help. Remember the diagram of the leaky gut. You can help preventing autoimmunity if you work the immunological insults and the environmental factors. Now, how does everything works? Strictly speaking, regarding to the stem cells, let's remember that the objective of the stem cell application or the use of the stem cell is not just to send stem cells and for them to home and fix and make everything happy. That's not how it works. That's one of the areas, or that's one of the activities on how the cells may work in different applications. However, what is going to take place every single time with every single patient is regulation of the immune system. By regulation, I mean controlling the hyperproduction of these chemokines or cytokines that you see in green, the ones that are tilting the balance towards the left, which are pro-inflammatory markers. The less presence or the less hyperactivity of the immune system is going to have an anti-inflammatory effect because we are increasing the anti-inflammatory markers. Remember, in autism, strictly speaking to the gastrointestinal tract, the most important one is the IL-10, the interleukin number 10. We have to tilt the balance to the other side, controlling or modulating the cytokines that are causing inflammation, okay? Now, stem cells, that's the goal. That is like the biggest jump and the most immediate result or the most immediate effect that they cause. That's why the number one change that our patients experience within the first 3 to 4 weeks is gastrointestinal changes, because it's the first thing that happens or that takes place. The actual modulation of the immune system starts to happen within the first 7 days after the stem cell application. And actual physical noticeable improvements, you can actually start identifying them by the second or the third week towards the end of the first month post-treatment. Now, remember, as I said on the previous webinar, and I'm going to say it again right now, stem cell is not everything. Stem cell is not the fix. The stem cell is a huge push, a huge jumpstart for the immune system, and we have to help them. Stem cells alone are just going to do this. But once again, if you have a problem this big and you are making it this big, let's not fit the problem in order to make them bigger, okay? How do we do that? Like this. On the left, you have a picture of a swollen or inflamed colon, okay? That's a regular, traditional, everyday colitis. With the use of stem cells, you're trying to increase the presence of anti-inflammatory cytokines. That's cool. Cytokines are not forever. So you are modulating the immune system response. How can you feed, how can you nurture this response? Dietary changes, fomenting or stimulating the adequate microbiota, probiotics, prebiotics, digestive enzymes, etc., etc. And this is going to make a happy environment for the mucosa of the gastrointestinal tract. The happier the mucosa, the better the immune system, because the mucosa will be absorbing. And we have had kids in here that from the first time that we made him towards, by the following year that we have them when they repeat the treatment, they gain about 6 to 8 pounds just in a couple of months. I'm not mentioning anything about stretching. They obviously stretch, but they gain weight. They look less cachectic. Sorry for the word, but that is an actual term. It's when they lose way too much weight or they have difficulty gaining weight, okay? So this is the way. Doesn't matter what diet, doesn't matter what protocol, doesn't matter what you do. The idea is try to provide the happiest environment, the most balanced environment to the mucosa of the gastrointestinal tract. And this leads me to the following image. It's very important for doctors, whichever doctor we're talking about, chiropractors, pediatricians, biomed doctors, MAP doctors, for parents, for therapists. It's very important to understand what we want. Everybody wants this, the happiest environment possible. Can be achieved, sure it can. However, this is what everybody wants. but we have to locate ourselves. We have to identify, we need to understand where we are. Are we like this? And we have to start considering in order for me to go to a very, very nice and beautiful garden, rainforest-like area, and I am like this, very arid and barely with a tree, we need to nurture the soil, we need to provide nutrients to the soil, we need to water it, we need to eliminate the bugs, we need to promote the necessary environment for green color to pop. Or are we like this, in which it used to be green, but somehow it's not that green anymore? So it's important to identify where we are located, because that is going to drive you through and to the adequate strategy to move forward to what we are actually looking for. Also, keep in mind, this is something that it doesn't take a week, okay? Dietary changes, it's something, even just the transition of the diet is something that takes a while. It takes maybe 3 weeks to a month, just the dietary changes, especially if your kid has an attachment to milk, if your kid has an attachment to gluten, if your kid has an attachment to something in particular. And sorry, but our patients are extremely smart. You cannot fool them that easy, okay? So the strategies have to be the adequate ones. Sure, you can try. It's going to be a matter of trying and adjusting and trial and error, but it can happen. For us to move from arid to very, very green and populated. Now, what can be done? Easy. Again, I'm focusing today on what can be done at home, as well as very basic approaches from medical perspective. Lifestyle changes, constant hydration, whether water, almond milk, coconut milk, etc., a clean diet. This is in order to suggest what can be eaten, what cannot be eaten. Again, I'm not talking about if my kid is allergic or not. We're talking about a clean diet. Reduce or eliminate simple carbohydrates. If your boy or if your girl is hooked with carbs, it can be difficult to eliminate the consumption of carbs, but it can be gradually, you can follow a transition in which you are substituting simple carbs to complex carbs. Maybe you can try eliminating casein. Casein is a very large molecule. It's a very large molecule that it's difficult for the gastrointestinal tract to break down and eliminate. Consider not consuming refined foods. By this I mean very refined flours, refined sugars. Actually, this is the nature of the boom or the trend of organic foods. Promoting some degree of physical activity, and most important, a healthy diet, a healthy gut. It will help you to avoid any form of regression. That is a fact, okay? Now, from the medical perspective, what can be done initially: probiotics, prebiotics, digestive enzymes, because digestive enzymes help to the gastrointestinal tract to break down different ingredients that at the beginning can be complicated or difficult to be broken down and absorbed. Consider supplements. Remember zinc and magnesium, number 2, that you can try, no harm whatsoever. Medication, I'm saying here medication if needed, especially when we're talking about anti-inflammatory protocols as well as yeast and or parasite protocols. If I'm not wrong, the very famous diflucan or fluconazole or any or of its derivatives for nystatin as well for yeast overgrowth can be used. It's very safe. What I do not agree with is to use it for a very long time. If you're going to use it for a very long time, it's going to be needed to evaluate a stool sample every now and then in order for you to know that you are not wiping way too much of it, because there is always the need of the presence of yeast at a some level, okay? It's part of the flora. It's bad when it's overpopulated. Same thing with parasites. And also because an abuse of medication can have a negative impact in the metabolism of the kid, gastrointestinal absorption, as well as the liver. And finally, stem cells. Why I'm mentioning stem cells? I'm mentioning stem cells because, as I said it before, it's like a shortcut in terms of bringing down inflammation. It's the thing that works the fastest, is the fastest result, and is the fastest improvement that you can notice. But the fact that the stem cell is an actual shortcut to bring down inflammation from this to this doesn't mean that it's the absolute solution, okay? It's a huge help, sure it is, but the fact that you're reducing the size of a problem doesn't mean that it's the actual solution. Remember, if you do stem cells and you're noticing improvements, if you want to avoid regression of the investment of what you did for stem cells, you have to follow a lifestyle, you have to follow a diet, you have to follow different activities in order to avoid, remember what we mentioned, what you have in hand, immunological insults, I have in here, immunological insults, and environmental insults. Environmental insults are those associated with what you eat, wear, or smell. Immunological insults are the ones associated to your immune system response because of what you eat, or because of vaccines and whatnot. I'm not going to dig into that, okay? So if you can actually promote both these factors to a better function, you are on the other side, okay? And finally, I love this. There needs to be a lot more emphasis on what a child can actually do instead of what they cannot do. Please always take in consideration, it requires the same amount of energy to be happy, to push, to drive your kid when you notice an improvement, than focusing on what your kid is not doing, but you are actually overlooking what your kid is actually achieving, okay? Remember what we mentioned once, behind every kid with autism, there is an overly active parent. All of you who are watching this, you are an overly active parent. You're doing your best. If we can help you, let us know. If you have any questions, feel free to write us, feel free to write me, feel free to write Dr. Eduardo. And by the way, yes, we are open. That's why I'm putting this one. We are open. We have been open with receiving patients since the past July the 10th. And there are different changes regarding the protocols, not the medical protocols, but the safety protocols of treating patients as well as receiving patients, as well as receiving tourism right here in Cancun. But yes, all the patients that we have received since July 10th have been safely treated. And if anyone is interested in knowing more about this, let me know. I can explain you very thorough about the protocols. The protocol, or the stem cell protocol, has not been compromised at all. Another thing, next time, or in the next webinar, that's why I didn't mention it that much about the diet and the supplements. On the next webinar, which is going to happen in 2 weeks, I'm going to talk about the 5 or maybe 6 common diets, how to identify if a diet is suitable for your kid, some of the basic supplements, and some of the basic tests that you can perform to identify and to sort out different things. However, the difference in here is that these ones may require the help of your physician, okay? So once again, if you have any question, please let me know. Send me a message, request a free consultation. Let's have a word over the phone. Let us help you. Have an excellent day or night.